Good evening, everybody. I'm Dan Nelson. I'm the Emergency Manager and Incident Commander for the Kenai Peninsula Borough. Thanks for joining us a little bit late this evening. Technology issues and bandwidth and all of those things require some additional planning. So we finally got some of our technical difficulties worked out in a little bit of a low bandwidth way. So hopefully you can hear and see me just fine on the phone. On my landline, I have Brenda Ahlberg, Public Information Officer for the team in the Kenai Peninsula Borough. Good evening, Brenda.
Good evening.
So hopefully you can hear us all, and again, apologies for a little bit of a late start, but I think tonight is really the key is to roll into your questions. Brenda, did we get some questions earlier in the day, or should we be posting to our comment feed?
We're going to do a little bit of a combo tonight. We've got some PIOs in the background that are monitoring the comment string. They are feeding me questions that are compiled so that we're not having to repeat several questions at the same time. And we'll roll right into what I think is a little bit of confusion regarding this evening's presser, we call it presser, or the governor's press tonight, and Dr. Zink's announcement of the case in Sterling. We want to make sure we're not confusing people that there's a new case. As of tonight, there is not a new case. Can you help expound upon that, sir?
Absolutely. So looks like based on some of the protocols and things that the CDC do, there was a case, but there's not anything, a case for the Sterling area. So we talked about last night how we had an additional positive in the Sterling area that was related to a previous case. We reported that. It was not included in the governor's press conference due to some timing issues. So what was announced tonight is what we announced last night in coordination with Department of Health and Social Services. So no new cases in the Kenai Peninsula today have we been notified of. So there was a little bit of a timing in that process. And as we've talked about before, there's a pretty specific notification process that comes from the Department of Health and Social Services to the patient, and then the patient's medical provider, physician, and then finally to the municipalities, and we work together to release that information. So hopefully clear as mud, but no new cases today within the Kenai Peninsula.
I just want to also contribute to that. We did a post early this morning just to really let folks know that it is so important to us that we get our communities the correct information. And by golly, if we're wrong, we're going to own it. We're going to let you guys know if we've done something wrong. And this is a good point in case because of the fact that all the coordination that's needed from the state all the way down to the notifications here at the local level, that we want to make sure not only are protecting that individual's privacy, but that we are also getting our residents the correct information. So thank you for that. I'm going to move into some other questions with regards to that. That's very similar in nature. I had a question today is why is there such a delay from when the borough reports cases on Facebook and when it's reported on the news by the officials? Can you talk a little bit about the 3 o'clock deadline?
Of course. So basically, so folks are aware, I touched a little bit about that notification process, that those things come from the state level and then while going through the patient's medical provider and finally down to us. So there's a 3 p.m. deadline at the state level for those types of things to get on the governor's press release or press conference. So because of that 3 p.m. deadline, our case from yesterday didn't make that, but we were still notified of it. So that's why there was a little bit of a delay and a little bit of confusion. That protocol works well, but sometimes with so many different things happening and us trying to get the information out just as quickly as we can for the public, those types of things happen. So once again, if you are just tuning into us, we're talking about a case where there was that we announced last night. There are no additional cases today in the Kenai Peninsula.
Another question related to the media and press releases throughout the state. Juneau News is reporting that one of their cases is inpatient and in critical care. Are any of the borough-related cases hospitalized?
No, there are no hospitalizations related to the cases we've talked about within the borough. All of those folks are self-isolated in their homes. So there has been no hospitalizations with any of the borough cases that we have here.
And I think I just want to bounce back to you. One thing that you said so eloquently a few nights ago with regards to the importance of patients' privacy, and that we as a borough entity, we're not going to get into the granular details of what a case may or may not be in the situation that they are at that time. Can we throw out just a little friendly reminder on that too?
Of course, and basically what it comes down to is again, everybody has the right to their own privacy when it comes to their medical condition. We will release kind of the overarching details of things as we've been talking about, but we're certainly not going to be talking in a public manner about, of course, who specifically these patients are, where exactly they are, those types of things. So we'll be able to share a general overview. We want to be able to keep the public informed over such a developing and dynamic situation. But just remember, when we talk about these cases, when we're talking about cases, we're talking about people. And so we want to respect that people are going through some anxious times, and making sure that we're respectful of that, and that we care and think about those folks' health. So we'll release just some very general information, but that's the limit of what we're going to release at this point.
All right, so moving on down the line here, we've got lots of questions that we're going to make sure we stay over. We'll make sure we do 30 minutes with folks, and we appreciate the fact that you're so patient with our delay. Talking about the State of Alaska Department of Health and Social Services mandate number 10 with regards to those industries that support critical infrastructure. And this question I thought was very telling with regards to the impacts here in the state. The question was, when you're picking up someone at the airport in Kenai, arriving from the slope, does that person need to do a self-isolation quarantine? And one of the things that was provided that I was able to confirm is that employees that are coming off the slope that are in the oil industry are considered part of critical infrastructure that are traveling to and from the slope. Would you like to add anything to why that mandate is so important as far as slowing the spread?
Of course. So the mandate and the critical infrastructure that we're talking about came out yesterday, and we talked about it a little bit on here. You can find it linked on kpboem.com. But basically that was the mandate to compel a 14-day quarantine isolation for those folks that come from out of state. As part of that mandate, the governor did include kind of an appendix to that, which talked about some of the key things and the key sectors like oil and energy production, firefighters, EMS, and some of those other critical things, and identified that infrastructure. So when we talk about that, it's not specifically necessary or mandated when you're coming from within the state of Alaska from the slope to self-isolate. But it's so critical that physical distancing and those things continue. And really what this comes down to is, we're talking about this virus that has a high transmission rate. We could be carriers, our children, anybody could be a carrier that's not showing symptoms. So even inside your own home, especially if you have been traveling in-state, if you have a job that requires some contact with the public, even though it's distanced right now, make sure that isolation continues, that you keep that physical distance, that you're washing your hands frequently, surfaces are being sanitized, all of those things that we've been talking about. But, if we're not physically distancing, if we're not doing some of those things, then we're simply contributing to the problem at this point. And it's critical for us to be able to flatten this curve and try and do the thing that Alaskans do, because we're seeing what not flattening that curve and what that is in other cities and states right now.
All right. And with regards to employees returning back to work, some employers are asking for doctor notifications. How is this going to be something employees can work through with their employers? What can employers do to get these answers and be able to create the modifications for their employees?
So from the standpoint of employers, there's a lot of things that we should be doing and a lot of great guidance out there. And so it's important to work with the information that we have, and there's great information for employers on the CDC website. So if you go to the CDC coronavirus website, I believe if you just go to cdc.gov, you can click on that right on the front page. Follow that advice, and employers should be taking all precautions that they can to make sure that distancing is in place, that their employees have their proper protection. And it all depends on the industry and the position, of course, for what kind of business you have. But really, the best guidance is go to that CDC website. There's specific information for employers. Pretty easy to get through. Take a look at that and follow that guidance.
Yes, and we certainly want to support private industry, but at the same time balance it with the importance of these mandates and what we are supposed to do to continue to slow the spread of this virus. So want to be mindful of that. We're not trying to tell employers what to do, but at the same time, it's just that balance of making sure that we get through this together. One of the questions that just keeps coming back to us, and I'm sorry, we just got to keep explaining it and sharing it to our new viewers, is why is the second-class borough not allowed to mandate its residents to go into a lockdown?
Of course, and a very good question to ask. And so in a real brief fashion, basically, boroughs and municipalities, cities, are formed using a specific set of powers and a specific set of things that we're able to do. The borough is a second-class borough as opposed to some of the other municipalities, say the municipality of Anchorage, where they have, I believe they might be home rule or first class. It doesn't really matter. What it basically matters is each designation has a certain amount of powers that they're given. The Kenai Peninsula Borough was formed with limited powers as a second-class borough, so we only have certain powers that we have. We do not have powers such as health powers. We do not have the authority legally to mandate any sort of work with private businesses. We don't have any of that. Any of our powers that we don't have on an area-wide basis, which are very limited, are held in service areas, and they're related to geography. So the long and the short of it is we do not have the legal authority to do so, but I highly, highly recommend that, beyond that limited authority, that we're not going to come out and say you must. It is the right thing to do. And so we encourage folks, hunker down, stay at home, maintain that physical distancing, and do the right thing. So even though we don't have the power to compel you to do so, we know it's the right thing to do, and it is so urgent for the health of our community as a whole.
All right. Moving on in the same vein of employees, the questions asked, are borough employees in cubicles or spaced apart? Are they, even though they're still closed to the public, what is their working environment right now?
So some of our borough employees certainly do work in cubicles. We have limited space, so like many workplaces, it's tight. But we're doing a couple of different things to make sure that borough employees are safe and healthy. So as the question mentioned, our facilities right now are closed to the public with just a few minor exceptions. And we are encouraging all of our employees that are able to do so to remote work. So some of our employees and some of our positions are more able to do that than others. But what we've done is by allowing some of those people to remote work, it allows the people that need to stay for their job duty or not having the ability to remote work to be able to have that physical distancing. So I actually went into the borough building for the first time in a couple days, and out of many, many cubicles, there might only be 2 or 3 employees. So by using that we're able to still provide the services that we need to provide, but keeping people safe and ensuring that physical distance is still there.
And that includes, as you were saying, shift changes. Some are working in the mornings, some are working midday or late afternoons to also practice that physical distancing.
Absolutely. Yeah.
Of looking at some additional questions that are coming in, and one of the things was, so the statewide salon shutdown, does that pertain to Kenai and Soldotna, since it was mandated by the governor?
And the quick answer to that is yes, it does. So the way the powers in the state of Alaska work is that the governor does have the ability, no matter what kind of municipality we're in, to mandate those types of changes in an emergency. So the shutdown for hair salons and personal care services does also include all of the cities on the Kenai Peninsula, including Kenai and Solana.
All right. Let's talk a little bit about testing. That is a question that is also coming up, even just from a point of clarification. Can you tell us how many tests are available in the state of Alaska? And then, of course, how many are available here in the borough?
Of course, I really can't address a specific number. I do not know the number of tests that are available either in the state as a whole or within the borough. I know in generalities, we've been talking to our hospitals and our healthcare providers. There certainly are tests being administered. I don't have the details on exactly how many. And I know that they basically have told us they are fine for now as far as number of tests. But I don't have those specific numbers from our healthcare providers, and possibly we may be able to have them weigh in to be able to address that. It's important to realize for the testing that it's not always simply just the COVID test that we're talking about. And I address this, but it bears repeating that when you call your healthcare provider, if you do have symptoms, they'll go through a screening process with you. And they may choose to give you a referral to test for the COVID-19 virus, or they may do other lab tests to rule out other conditions before going through to that COVID-19 testing. So it all depends on your healthcare provider's recommendations and what is best for each particular situation. The state has said that people that are not showing symptoms will not be tested. So if you are showing symptoms, again, give your healthcare provider a call, and they'll advise you what to do next. Don't go in until you've given them a heads up so they can give you instructions that are appropriate for your case. And hopefully we have not lost Brenda, as that might be something in our technological challenges that we are continuing to have tonight. So Brenda's back there, so good. We'll have some more questions for us.
Yes. So basically, I can't just go up and ask for a test. I just can't walk up to the hospital and say, I really feel like I need to have a test.
No, they will not test you under those scenarios. You must go through your physician, and they will give you a referral if a test is appropriate.
One thing that I would like to share is on our blog, as well as on the state's page, the self-assessment, providence.org, as well as a beta test that's being done by Emory University. Both of those are on the Boroughs site. You can walk through the self-assessment, and then, of course, if it's necessary, we'll recommend should you need to call your healthcare provider. One of the other things that's been brought to our attention that is very important is with regards to who I hold very dear, my fire family. When someone calls dispatch and they believe that they need assistance, there's a protocol in place for that caller to answer questions. Can you describe for us what the dispatcher is going to do when they receive that kind of call?
Of course. So if you do have need, of course, we want to make sure that people are calling 911 if they have a medical need. Absolutely do that. We're still here to serve you, and there will still be a response. The dispatcher will ask you some additional questions. So essentially, they'll get some basic information from you, and then based on what service you need, and that applies to fire or medical service or even law enforcement service, they'll ask you a few questions about your status. And I do not have the questions in front of me. I don't recall them off the top of my head, but expect a few more questions about if you are showing symptoms or your travel history, or perhaps if anybody in your household is showing symptoms. And that's simply for the protection of the responders. It's essential that we be able to keep our first responders healthy and safe and keep that service going no matter what the condition is. And that's something that all of our first responders and everybody in all of our fire and police departments across the borough take to heart and take very seriously. So please be honest when the dispatchers are asking you those questions. It's No judge, there's no penalty, but it will give us an idea if we do need to take any extra precautions. And on that same vein, you may see police officers or firefighters or paramedics in additional protective equipment. And again, that's just, again, to keep people safe and to make sure that we keep them going, so they are here to serve you.
Thank you. And that's just a great reminder, again, that our first responders truly are there to serve our communities. That's still going to happen. And the importance of having that initial evaluation with the dispatcher allows them to don that protective equipment, that PPE that Dan is talking about. Otherwise, if they go to a response and realize that they need to put on that equipment, that's just one more step in the process of response. So we really appreciate people understanding why that is so important. Moving into some other questions that I know that we can't address it here, but we're going to put it on the blog tonight, is there's been questions about how many cases may be in other communities that folks would like to see on the blog. So I will be adding that link tonight. It's a link from the Health and Social Services page that's a count by communities. And we'll make sure that that gets up for you guys tonight, so you'll have that. In general, some of the other questions that have come up, can pets get COVID-19? And while there's no evidence, why is it so important that if you're self-isolating, you have symptoms, why should you stay away from your pets, from our fur family here, our furry friends?
So it's an important point, and they have, and you may have heard earlier that there was a pet that had showed some positives from quite a few months ago. Really, right now, there is no evidence that pets can get the COVID virus. However, pets can spread the COVID-19 virus. So when you're, just like you're touching any other surface or anything that you might be handing to other folks, that can be on the dog's fur or something along those lines, a collar. So it's important for us to be mindful of that if the pets are visiting the kiddos or other people in the house. Let's keep some distance from our fur friends as well.
Thank you. And I will also provide that link for people because we had a lot of questions. So people are really concerned about their pets. And I pulled that up on CDC specific guidance for if you're managing people or if you are isolated, what you should do to be mindful of your pets as well. Yep. Another question that's come up, I'm going to read it verbatim. Why are people who clearly have symptoms being turned away since they haven't traveled? Are there so many more people who have the symptoms in the community that are not being tested? I think that comes back to that initial evaluation.
Yes, I would. I'm going to make an assumption that there was something in the evaluation or the screening process that might have indicated that. Of course, I don't have any firsthand knowledge of why somebody would be turned away, but I do know that essentially there is a checklist or a matrix, so to speak, that all of our providers are using to determine whether it may be COVID or some other type of sickness, and then they order lab tests and other actions specifically for what they determine from their clinical diagnosis. So while I can't address any specific things, I haven't heard that. It may be based on the individual medical case or some other fact that we're not aware of. So I'm afraid I can't speak more to it than that, but that is the general overall process.
Thank you. Of those tests, I'm assuming again in generalities, how many have been negative versus pending results? And I did reach out to the hospital to ask if I could provide a little bit of information on that, and they're averaging about 10 tests a day, and that didn't have anything to do with results right now because the results are taking quite a bit of time to come back. Can you share a little bit with us, again, why it's so important based on it taking so long to get those results, what we should be doing?
And really that comes back to that self-isolation and staying in your home. So, we have these tests that are happening. People are getting tested. They're getting sent off to labs. Where they're being sent off to is kind of depends on the priorities and the different symptoms and again, a clinical diagnosis by physicians. But, until those tests come back, the best thing that we can all do is isolate in our homes. We've heard it time and time again, whether we're talking about the Kenai Peninsula Borough, Anchorage, other states and other municipalities. Basically, heed the advice that all of your leaders are telling you is stay inside, self-isolate, make sure you're not going out except for very essential errands, and when you are, make sure you're doing that social distancing, at least 6 feet. And if you've had travel or you are ill, it may be necessary to make sure you're distancing in your home as well. But that is the only way that we are going to be able to stop and slow the transmission of this virus. So it's just essential for us to be able to do that. And we're not putting out a mandate. We've talked about that in this video, that we don't have the power to do so. But all of us have the power to do the right thing and to care for our elderly population, others that may have medical conditions that might be more vulnerable. Even if we're healthy ourselves or we're young, we can still be carriers. So if you have been tested, stay home.
All right. One of the questions that really warms my heart, and I know you're going to like this one, and it has to do with our whole community. Is there a process in place for community members to volunteer if the need arises? I think this is a great segue into the whole community planning and testing of that plan that your office, through Office of Emergency Management, has been working on now for about a year. Can you share a little bit about that?
Of course. So just briefly, the whole community concept is a bit what it sounds like, is that we know it's important for all of us when we are dealing with emergencies, whether that be an unprecedented pandemic like we're dealing with now, or whether it's a wildfire, or whether it's an earthquake, that it's important for the entire community to be represented in that process and in that planning, but also to be able to contribute to the recovery. Because if we work together as a whole community, then we are going to be able to achieve success in a much better way than the limited resources that a city or the borough has. So to answer specifically to your question, we have been looking at that. We are kind of putting together some of those plans for volunteers. We've been getting some requests in, and we have been kind of keeping a catalog of people that have wanted to volunteer facilities or volunteer their time. Please keep an eye out for that. Right now, there's not a great need that we've been able to identify, and we want to be very cognizant of our physical distancing as well, but that may change as things go through. So I will say please hold that. We may be putting out a call for volunteers through different agencies or directly on our Facebook or our blog. So just please keep an eye out, and as that need arises, we will certainly be asking folks to help us out so we can get things done that we need to get done in the various communities. So stand by.
Thank you. One of the things that I will say that I would really like help with, and they say that if you ask, you better be very careful how you ask. And so I'm going to try real hard to articulate this. I'm going to follow it up with a post, is that there's about 20% of the borough that doesn't have really good internet or no internet. And so if you are on the internet, you have the ability to get these updates. You have the ability to go onto the blog and pull down the situation report, the SIT report that's coming out every day around 4 o'clock. Call a neighbor, call a friend, share with them what you know and that you're getting it from a trusted source, so that it can help hopefully ease the angst that folks are feeling that may not have this information that you have. So that would be the first call of action that I'd really like folks to help us with, is get on that phone and say hi to your neighbor, to your loved one, and share with them what you're learning every day from us here at KPB Alerts and on the blog at KPB OEM. I am going to wrap it up, and I'm going to throw it to you for a closing comment, just reminding people that we are not able to answer agency-specific questions. We'll most certainly try to get you the information that we can, and we'll pop it into the comment thread. And with that, Dan, I'm going to turn it over to you, and I'm going to sign off and say goodnight to everyone.
Thanks so much, Brenda, and thank you for that ask. And while we are thinking about that and thinking about Brenda's ask to share that information with your neighbor, at the same time, that's a good time to check in with your neighbors and check in with your friends that you may have lost a little bit of touch with, as we are in some of this physical distancing and isolation. I appreciate everybody's patience today in our technical difficulties. This is probably not looking quite as polished as you're used to, so we'll work on that. Reminder, we'll be back each evening at 7 p.m. You can submit your questions on the KPB Alerts Facebook page, and we'll work on that, and please share this post. With that being said, it was a good day. We had a lot of things done. We got some protocols specifically for patients and transporting them from some of our more rural communities. So that was a great thing, and just a little bit more in working with some of our cities and hospitals. So with that, I'm going to go ahead and wish everybody a very good evening, a little bit later today than usual today. But thanks for sticking with us and joining us even after we had a little bit of trouble getting our live stream. So remember, kpboem.com. And remember, please stay inside, check in with your neighbor, wash your hands, and have a great night.